The silent heart muscle clogger, ATTR amyloid, we're going to talk about. I'm Dr. Evan Levine, board certified cardiologist. Are you being treated for heart failure, shortness of breath, swelling in the legs, but your doctor says your EKG looks a little funny? There's very small voltage, but your heart is real thick and kind of functions well. They say you have heart failure with preserved ejection fraction, but there may be more to that. If you also have a history of carpal tunnel syndrome in your wrist, and maybe you've had spinal stenosis, you noticed your bicep muscle looks ruptured without an injury, we call that the Popeye sign. It may be something more. It may be ATTR amyloidosis. And that's a condition where the liver protein misfolds and turns into a biologic sludge that clogs your heart muscle. Now, you have to be your own advocate because this is missed for years. You could demand three of the things if you had those symptoms. 1, a blood and urine. We look for light chains. This is crucial to rule out a more aggressive cancer-related version called AL amyloid. And 2, a PYP scan. This is a scan of your heart, and it's very accurate to see whether or not you have infiltration with amyloid. And 3, genetic testing. You need to know what type of this amyloid is, and if it's hereditary or not. Your siblings and children may need to know this. The reason I'm telling you now is because as of 2026, we have 2 defenses that are changing lives. One are called the stabilizers. These are drugs like tafamidis and the newly approved acoramidis, and they act like glue to keep the protein from falling apart and clumping in the first place and infiltrating the heart. And now we have something called the silencers. This is a pretty significant breakthrough. Drugs like vutrisiran, which has been shown in a trial called Helios B to significantly reduce deaths and hospitalizations, and it's an injection that you take every 3 months. It tells your liver to just stop producing the toxic protein. So we're moving towards a world where there is a manageable chronic condition, not a death sentence, but you can't treat what you don't name. If you have a story of heart failure with preserved ejection fraction and a history of carpal tunnel syndrome or the Popeye sign, show your doctor the references in the caption.